Hi, gays. Welcome to News Today. Human metapneumovirus, HMPV, cases on the rise, causing concern among health officials. Health officials are closely monitoring an increase in cases of human metapneumovirus, HMPV, a common respiratory virus that can cause a range of illnesses, from mild cold-like symptoms to more severe respiratory infections. The rise in cases is occurring across various age groups, raising concerns about potential strain on healthcare resources and the need for increased public awareness. HMPV is a single-stranded RNA virus that was first identified in 2001. It belongs to the same family of viruses as respiratory syncytial virus, RSV, another common cause of respiratory illness, particularly in young children and older adults. Like other respiratory viruses, HMPV typically circulates in the fall, winter, and spring seasons. Symptoms and severity. The symptoms of HMPV infection can vary depending on the individual's age and overall health. Common symptoms include cough, fever, runny nose, sore throat, wheezing, shortness of breath. In most cases, HMPV causes mild illness that resolves on its own within a few days. However, certain populations are at higher risk of developing severe complications, including infants and young children, older adults, individuals with weakened immune systems, people with underlying respiratory conditions such as asthma or chronic obstructive pulmonary disease, COPD. Severe HMPV infection can lead to bronchiolitis, inflammation of the small airways in the lungs, or pneumonia, infection of the lungs. In rare cases, it can be life-threatening. Current situation and concerns. Health officials have observed an uptick in HMPV cases in recent weeks, with some regions reporting higher numbers than in previous years. While the exact reasons for this increase are still being investigated, several factors may be contributing, including increased awareness and testing for HMPV changes in circulation patterns of respiratory viruses following the COVID-19 pandemic, potential emergence of new HMPV strains. The rise in cases is concerning because it can lead to increased hospitalizations, particularly among vulnerable populations. This can put a strain on healthcare systems, especially during times when other respiratory illnesses like influenza and COVID-19 are also circulating. Prevention and treatment. Currently, there is no specific antiviral treatment for HMPV. Treatment focuses on managing symptoms and providing supportive care, such as rest hydration, over-the-counter pain relievers for fever and discomfort, bronchodilators or corticosteroids for wheezing and difficulty breathing. In severe cases, preventive measures to reduce the spread of HMPV and other respiratory viruses include frequent hand washing with soap and water, avoiding close contact with sick individuals, covering coughs and sneezes, staying home when sick. Public health recommendations. Health officials are urging the public to be vigilant about respiratory hygiene and to seek medical attention if they experience severe symptoms of HMPV infection, especially if they belong to a high-risk group. They also emphasize the importance of staying up to date with recommended vaccinations, including influenza and COVID-19 vaccines, to help protect against other respiratory illnesses. Ongoing surveillance and research are crucial to better understand the epidemiology of HMPV, identify risk factors for severe disease, and develop effective prevention and treatment strategies.